This presentation has been put together by the Hertfordshire and West Essex Integrated Care System Primary Care Training Hub. Our presentation talks about what it is like to work in primary care, which is the care you receive from everyone at your GP surgery. Rather than talking through all of the different roles, we have decided to present a short story about a patient's journey through their GP surgery. We will talk about the different healthcare professionals our patient meets, as well as the career path they took to be in that role. Just to say that all of the characters in this story are fictional. However, what takes place is an accurate representation of a patient's journey and the healthcare professional's career paths. Our patient's name is Lana. Lana was talking to one of her friends at school when she was approached by a group of older students who had been bullying her over the last few weeks. They had been teasing her about the fact that she has started playing football, which they say is a game for boys. One of the students pushed Lana and she fell, scraping her leg against a rusty gutter and twisting her ankle. Lana managed to hop around for the rest of the day, and when she got home she took some paracetamol and put some ice on her ankle. By the next morning her ankle was a bit swollen, but the biggest problem was the cut on her leg, which had become red and sore, and Lana knew that she would need to go and see a doctor at her local GP surgery. Lana could hear her parents arguing downstairs and decided not to bother them, but telephoned the GP surgery herself. The telephone was answered by the receptionist, Mary. Mary left school at 16 and, because she didn't know what she wanted to do as a career, worked in her father's carpentry business over the summer, answering the telephone and putting through orders for materials. She found that she really enjoyed this work and has dreams of one day becoming the manager of a business. She saw an advert for the receptionist at a GP surgery and decided to apply for the job to gain some more experience. Since she started working there, she realized how much she enjoys speaking to the patients who call up. She got to know the practice manager, Keith, as they work closely together, and she has been inspired by Keith's story about how he worked his way up from receptionist to practice manager. Keith will be retiring in a few years' time and has spoken to Mary about doing an apprenticeship. Mary is interested in completing a business management apprenticeship, and Keith has agreed to be her supervisor. She will be starting her apprenticeship in a few months' time. Lana feels a bit embarrassed about how she sustained her injuries, so she just tells Mary that she has a cut on her leg. Mary listens to Lana describe the injury, and she advises her that the best person for her to be seeing is Sue, the practice nurse. Sue and Lana talk about the injury, and Lana describes how she cut herself on a rusty piece of metal. Sue cleans and dresses the wound, which is very red, sore, and painful. Sue explains that the wound looks infected and that antibiotics are required. Sue is currently undertaking her non-medical prescribing course at present and explains that she needs to discuss the treatment with her supervisor, the GP. Therefore, she calls Dr. Hassan, who comes to the consulting room. Dr. Hassan and Sue look at the wound together, and Dr. Hassan agrees with Sue's assessment that antibiotics are required. The prescription is sent to the chemist, and Sue advises Lana to book a follow-up appointment with Ishfaq, the healthcare assistant. Ishfaq used to be the practice receptionist, but he realized that he had a strong interest in patient care. He spoke with Keith, who agreed to support him to complete a care certificate, and he now assists the practice nurse by seeing patients with minor wounds. Lana goes back to the front desk, and Mary asks how she got on. Lana says that her leg feels much better, and that Sue has asked that she make a follow-up appointment with Ishfaq, the healthcare assistant. Lana is about to leave the surgery when Mary notices that she is limping. Mary asks if her ankle is okay, and Lana mentions that she also injured it at the same time as getting the cut on her leg. Mary remembers that a first contact physiotherapist has just started working at the practice and asks Lana if she would like to see the physiotherapist. Mary checks the physio's diary and sees that she has a slot available in 10 minutes, and Lana takes a seat in the waiting room. When Lana's name is called, she makes her way through to the physio's consulting room. Gemma greets her and explains that her role is to assess any musculoskeletal injuries, give advice, prescribe exercises, and potentially refer Lana on to the community physiotherapy team for further rehabilitation if she requires this. Gemma studied to be a physiotherapist at university by completing a Bachelor of Science degree. She started working as a junior physiotherapist in a community physiotherapy clinic and then went on to complete her advanced clinical practice course in order to become a first contact physiotherapist. She works in the surgery 3 days a week and spends the other 2 assessing and treating sports injuries at the local football club. Lana feels very comfortable with Gemma, and while Gemma is assessing Lana's ankle, they start talking about football, which they are both passionate about. Lana admits to Gemma that she has been teased for playing the game and that it was because of this that she sustained her injury. Lana also talks about the fact that her parents are getting a divorce, and she doesn't feel that she can tell them about the bullying because she knows it'll just cause them more worries. As a result, Lana has become more withdrawn. She isn't doing very well with her schoolwork, and she feels that she just doesn't have any motivation for football training anymore. She's also worried that now, because of this injury, she won't make the team for the next few games. Gemma listens to Lana and realizes that what has been happening to her has been affecting her mental health. She gives Lana some advice on how to look after her ankle over the next few days and gives her a sheet of exercises to complete. She also reassures Lana that the injury will heal quickly and that she will be able to return to playing football in about a week. She then asks Lana if she would consider seeing the mental health practitioner at the practice. Lana isn't too sure about what the mental health practitioner can do for her, but agrees to this referral. When Lana enters Orlo's consulting room, she immediately feels at home. Orlo greets her and they sit and talk about the things that have been happening in Lana's life and how they have been affecting her. Orlo and Lana agree on some strategies that Lana can develop to help her manage this turbulent time, and they agree that Lana will come back to see Orlo in a couple of weeks. Lana feels very relieved to have spoken to someone about how she is feeling. As she leaves the surgery, Lana thanks Mary for all of her help. Mary is delighted to see that Lana has a large smile on her face and that she's told her that she feels as though a huge weight has been lifted from her shoulders. Later on, all of the practice staff get together for their weekly meeting. They review some of the patients they have seen that day and talk through the cases. Dr. Hassan, the GP, is leading the discussion today, and he asks Sue how she got on with prescribing Lana's antibiotics. Gemma and Orlo also mention that they have seen Lana, and they explain to Dr. Hassan what treatments they prescribed. Dr. Hassan agrees with all of the interventions that his colleagues have described, then he turns to Mary. He recognizes the role that she has played in Lana's care by signposting her to the correct professionals and thanks her for all of the hard work that she has been doing in making sure that each patient that comes through the doors gets the help that they need. By doing this, it ensures that the GPs are available to see the patients who really need their care, while other patients are assisted by the healthcare professionals most suited to their needs. This is just a short example of how every role in the GP surgery is important in a patient's care journey and that each and every person can make a difference in someone's life. In this example, Lana was assisted by the receptionist, healthcare assistant, practice nurse, first contact physiotherapist, mental health practitioner, and GP, but there are many other roles in general practice as well. For example, dietitians, occupational therapists, paramedics, social prescribers, physicians associates, and nursing associates. Thank you very much for listening to this presentation, and you can contact us at hwetraininghub.org.uk if you have any further questions.